Plan, Do, Study, Act, Cycle, PDSA. Plan to test the change, carry out the test, analyze data, determine modifications. The objective is to decrease the incidence of IV compatibility-related near misses. What we think will happen. Near miss incidences will be decreased. Plan for the test of change. Who, what, where, and when. BCMA systems will prompt nurses to answer questions when administering IV piggyback or IV push medications in order to intervene if solutions are incompatible. Document unexpected observations and problems. Pushback from nurses with implementing a new workflow which adds steps to their current medication administration. Managers hesitant to carry out new workflow due to increases in cost and time associated with product purchase and training. Confusion from patients about being part of a new workflow test. How do findings compare with predictions? Near misses were prevented with new BCMA prompts prior to administration. What was learned from the test? Nurses like having easier access to resources since they have heavy workloads. Nurses are often under stress, which can lead to forgetting steps, which is relief with compatibility built into the BCMA. Nurses were willing to provide feedback for the new workflow. What modifications should be made? Frequently assess nurse stress levels and satisfaction with the new workflow. Provide feedback, support, and help. What is the next test? Test whether nurses become more comfortable with the new workflow and implement necessary changes. BCMA systems prevent numerous medication administration errors. However, they do not prevent all. After conducting the root cause analysis and identifying root causes, the Plan, Do, Study, Act cycle can now be implemented. The Plan, Do, Study, Act cycle is performed to do a small test of change in order to develop practical solutions for implementing change. In order to effectively prevent these types of near misses, healthcare organizations will have to work with the creators for the BCMA system in order to create a function that will prompt nurses to input whether or not the IV medication they're administering is going to be administered into the same line as something else. If the answer is yes, they are prompted to scan that package, which will give an OK for compatibility or inform them to use a different line if incompatible. The creators of the BCMA system should also have a link available which will allow nurses to pull up the compatibility chart from their computers while they're looking up their medications. Once this has been added to the BCMA system, the IT department and/or education department will need to be briefed on how it's used so that they can in turn teach the nurses on the new workflow. To implement this workflow successfully, cooperation and collaboration between all these parties as well as the management team must take place. The time frame for creating this functionality within the BCMA system, disseminating the education to the nurses, and testing the new workflow should take approximately 3 to 6 months. Management will have access to data collected from the BCMA system, which will report the instances of medications that were incompatible that were prevented, as well as every time a nurse utilizes the compatibility chart from their computers. If this trial proves to be successful, then the new process will become standard practice, and if it proves to be unsuccessful, then the cycle will return back to the plan stage.